Welcome to the Resolve webinar on egg quality. We're excited to share this very important information with you with one of our nation's experts in the space of infertility and reproductive endocrinology. Advance the slide. This is Barb Calora, and I'm with Resolve, the National Infertility Association. I'll be moderating the webinar today and asking Dr. Stewart a few questions and making sure that we are providing you with all the resources you need to further your research and exploration in this area. Advance the slide. Our expert today is Dr. Abby Stewart. Dr. Stewart is a board-certified obstetrician and gynecologist. She's also a reproductive endocrinologist. And she is with the Mayo Clinic in Rochester, Minnesota, and she chairs their reproductive endocrinology and infertility division and is an expert on providing the best quality care to people who are experiencing infertility. Thank you so much, Dr. Stewart, for joining us today on this very important topic. Why don't we go ahead and advance this?
Thanks to Resolve.
Slide.
And thanks to Resolve for starting this dialogue, because egg quality is a critical issue that many more women should be talking about. So I think the first question is, why does egg quality matter? There are a lot of reasons egg quality matters. First of all, eggs are a non-renewable resource. Unlike sperm, where men make sperm every day, women are born with all the eggs they will ever have. So there's not an option to make more eggs or to make better eggs. Secondly, women's lifestyles have changed dramatically in the past few decades. And right now, women are 9 times more likely to have their first pregnancy after they turn 35 compared to 40 years ago. So keeping options open for pregnancy at later ages has been a key change in our society. I think the other thing that's linked to egg quality that isn't as well known is not only do fertility rates decrease as women get older, but miscarriage rates increase. And so it's really a double whammy that you may have more difficulty getting pregnant and then more difficulty getting to a delivery if there's an egg quality problem. Next slide, please. So it's really important that you be your own advocate regarding the issue of egg quality. And I think there are a couple of tips that are important to share. I think the first one is to understand your body. If you've always had absolutely regular 28-day menstrual cycles, and you're suddenly changing so that you're having shorter cycles or longer cycles or completely unpredictable cycles, that's an important clue that something is changing. It may be related to egg quality, it may be related to another medical problem, but it's clearly an important clue that you should discuss with your healthcare provider. The second thing is that understanding the concept of egg quality is really important as you think about your reproductive health. And luckily today we have lots of information. You can get information through books, you can get information through the internet. You don't have to depend on your doctor's appointment to get all of the information you'll need to make the right decision for you. The third tip is you really need to communicate with your doctor. Many women are hesitant to discuss some of these issues with their doctor or their nurse practitioner or the healthcare provider that's coordinating their care. But I think this is really critical, is to say, I'm worried about this issue, or my fertility is the most important goal for me in the next year, or fertility is the most important goal for me, but I'm not going to be able to get there for about 5 years. And to understand what your issues are and what your priorities are is an important dialogue you need to have. The final thing is that there are more options today than there used to be, so you should be aware of your options. When I first started practicing, it was either get pregnant now or you may be out of luck. And so I think now there are many other options for fertility preservation, including things like freezing embryos or freezing eggs that may not have been available to women in a prior generation. So I think understanding and exploring these options is really critical. Next slide, please. So I think when you have your visit with your healthcare provider, there is some important information to share. The first thing to share is whether you've been trying for conception and how long. The period of time that you're trying varies based on your age and your history, and so it may not be obvious to your provider that you've been trying for 1.5 years and haven't had any success. The second thing that's important is to let your provider know whether you're trying for conception as a single woman or whether you're trying as part of a couple, because this can influence the options that you have available to you. Third, although your doctor should know in general your medical history, be sure to emphasize if you've had something that may have an impact on your fertility. Sometimes even something that happened 10 or 20 years ago may have an impact, and particularly if you've had surgery on your ovaries or your fallopian tubes or your uterus, that's important information. Or if you've had chemotherapy or radiation for a medical illness that's unrelated to reproductive function, that may be important information. Although we typically think of chemotherapy or radiation as being done exclusively for cancer, sometimes these procedures are done for other reasons. So women with rheumatologic diseases like lupus may be having some kind of chemotherapy, so that's important to keep in mind. The next part of the history that I'd like to emphasize is that your family history may be important. Although family history isn't always your destiny, if women in your family tend to go through an early menopause, that may be important information for you and your doctor to discuss. Finally, if your period is changing, that's a critical bit of information. As we discussed before, if you've always had clockwork periods and now all of a sudden something different is happening, it could be a clue that it relates to egg quality, or it could be a clue that something else in your medical or reproductive health needs to be investigated. Next slide, please. So there are also specific questions you can come prepared to ask your healthcare provider. The first question is, are there tests that I need to see how my ovaries are functioning? These days that there are a variety of things that can be done, sometimes blood tests, sometimes ultrasound-based tests can give us information that's important. The second question would be, what fertility options would I have? And again, the options may be different if you're seeking fertility as a single woman versus as part of a couple. It may have implications for your age or for your medical history. And I think the third thing is what's typical for women my age. because age is one of the most powerful predictors for egg quality that we have. Even with similar medical issues and reproductive history, the answer might be different if you're 22 versus if you're 32 or if you're 42. And I think finally, if you're going in the direction of some kind of either exploration of your options or even committing to a fertility preserving option, you need to have detailed information about costs and benefits and side effects that many of us want to give you the best medical advice we can, but it's also important to have this other piece, what it's going to mean for you in terms of costs and what you experience, and that's a critical part of the discussion. Next slide. So there are some key factors that affect egg quality, and as I alluded to before, age is clearly one of the important factors. Although we can fight some of the effects of aging in terms of our muscle health or our cardiovascular health, it's much harder to get around the effects of aging when we're dealing with egg quality. Secondly, your family history plays a role that many women will have a family history that affects their egg quality and their options for fertility. And this is important in addition to their medical history, especially if you've had chemotherapy or radiation. Finally, it's less clear that we have clear information about environmental toxins, but these are clearly playing a role in terms of egg quality. So if you have a job or have had an exposure to an environmental toxin in the past, this can be something important to discuss with your healthcare provider. Next slide, please. I think this is a very fast-moving field, and in fact, just within the last 2 months, there has been a very important statement in the New England Journal of Medicine about fertility preservation. And this is a prominent medical journal that really sets the agenda for many of the groundbreaking information that we use to decide medical care. And Dr. Shatman, a prominent fertility physician, stated that we need to be discussing the possibility of fertility preserving options with all women who are in their early 30s. And I think that this is a statement of the importance of discussing fertility preservation and really goes beyond what many physicians are doing currently, where they don't start to talk about these options till women are in their mid-30s or sometimes even early 40s. So I think that this is going to change the kind of discussions we're going to have throughout the country and throughout the world, recognizing the importance of this key issue. And I think the second part of the advice from this article is that before you spend the time and the money and the energy on some invasive fertility preserving option, you really need to understand the realistic chances of pregnancy based on your age. That if all things were being equal, then everybody would want fertility preserving options. But because most of us are weighing into the equation the cost or the time off of work or the success rates, that these are all critical issues to have as a part of a detailed discussion. So I think that the importance of egg quality is increasingly recognized. And I hope that many more women will be having detailed discussions on this topic with their healthcare providers. Next slide.
Thank you so much, Dr. Stewart. I want to provide some resources for you in your own research. The first one is reproductivefacts.org. This is a patient-friendly website provided by the American Society for Reproductive Medicine. It has a wealth of information on a number of topics, but you definitely will find specific information about egg quality and also general information about infertility and many of the things that Dr. Stewart referenced. The Resolve website, you can certainly find a wealth of information here as well. And SART.org is the Society for Assisted Reproductive Technology, and this particular website can provide you with also a number of resources, but in particular, this website captures the IVF success rates by infertility clinic across the country. And so you can look at a particular practice's pregnancy outcomes and so forth, and it's broken down by age, so it's super helpful for you to try and figure out in your own age bracket what a particular clinic might be doing. It's a way to start a conversation with your medical provider. So you can certainly print off a page from start.org of a particular clinic and bring that in with you for your appointment or consultation, or even if you're talking to an OBGYN. But it's an opportunity for you to then say specifically regarding women of your age with your particular diagnosis, what might be their own pregnancy outcome statistics that they have that will help you determine your course of treatment. So 3 really good websites. I would also suggest a book that is a great resource. It's called the Mayo Clinic Guide to Fertility and Conception. And you can probably find that on Amazon or any other of the major booksellers. Again, the Mayo Clinic Guide to Fertility and Conception. A great resource for all things related to trying to conceive. So if you want to advance this slide, Dr. Stewart, we went to the Resolve community through social media and other ways, and we asked them to provide us with their most burning questions as it relates to egg quality that we could ask you today. So I'm going to see if you can provide some good answers. I know they'll be good answers, but some answers for our community. So you mentioned going to your OBGYN, being prepared and having already some good information, but really the truth of the matter is that's a difficult conversation. So how do you suggest that somebody starts that conversation with their OBGYN regarding egg quality?
Yeah, I agree with you, Barb. It's absolutely a difficult conversation to have. And I think the first piece of advice is to really just speak from the heart. You know, that when I have someone that comes into my office that says, you know, having a baby is the most important thing to me. I need to talk to you about this because I'm 35 and I'm in school and I'm not going to be able to pursue fertility for another 5 years. Or, you know, my partner and I have been trying for pregnancy for 4 years now and we haven't had any success. I think to take that first step and bring the topic up and to also signal the importance to you is a critical first step. I think it's a key issue for many women. And again, if you're at your annual visit and the focus is on pap smears or breast health or other things, it might not naturally come up. So I think to be able to start the conversation is important. I think the other thing is it's helpful if you can convey the fact that you've done some homework, you know what some of the options are. If you're really trying to say, is egg freezing the right option for me? I've been reading about this, and I know how important pregnancy is to me. I'm thinking this may be something I want to do. Or, do I need to be going in a different direction? So I think taking that first step, speaking from the heart, communicating what you know about options and what you know about your situation. Gee, I don't know if you remember, but when I was 18, I had chemotherapy because I had a thyroid cancer, and I'm cured now, but I'm wondering, is this affecting my fertility now? I think, again, trying to get to the heart of the matter is probably the most important first step.
Great advice. So now the big question from our constituents is there a way to determine how many eggs I have remaining in my ovaries? Everybody wants to know the number. Tell us your wisdom on this very important question.
Well, knowing that number is sort of like knowing the number that's going to win the lottery. Nobody knows for sure. We have some guesstimates, and so now there are some tests that we can do that can tell us, are you in the right ballpark for women your age? But there's absolutely no number that says this number is good and anything less than that is bad. We certainly have women that have bad numbers and go on and have healthy deliveries, but at least to kind of get a sense, are you in the right ballpark for your age, there are a couple of tests that are increasingly used. Two of them are blood tests. There's a blood test called an AMH, or an anti-Mullerian hormone. That's a hormone produced by the little small eggs in your ovary. And then there's a pair of hormones that are drawn at a specific time in your menstrual cycle that check the brain hormones that stimulate the ovary and the ovarian hormones that balance that. So those are called FSH and estradiol. So people may have heard about those blood tests. There's also an ultrasound-based test to look at those little small eggs called an antral follicle count. But absolutely, there's no magic number. Sometimes nature does just fine recruiting the right egg to achieve a pregnancy. But particularly if you're thinking about preserving your fertility and freezing eggs or freezing embryos, then having more eggs to choose from can be a better option. Does that make sense, Barbara, or are there other issues that you talk about?
Yeah, I think that you starting with the lottery reference is a very good one, and I think putting that in perspective really helps people as they look at some of these tests and other indicators and work with their physician on determining their success with having a child and perhaps with fertility treatments. So lastly, what are the other factors that come into play that may help create good egg quality?
That's a really tough question that we don't think we have major interventions that can change the quality of the eggs. But we know a lot of other factors go into recruiting the egg and making sure that there's sperm available at the right time. So I think, again, if you're thinking about pregnancy, being in good physical shape helps. If you have any underlying medical conditions, making sure that those are in control and optimized are important, particularly something like diabetes. If you have diabetes and it's not well controlled, that's a problem for producing a healthy egg. And so making sure that any medical problems are controlled is important. I think decreasing stress to the extent that that's possible when this is an important goal for you is important. And also making sure that you have exposure to pregnancy at the times that are best for the egg is critical. So again, most people know that having sex sometime around the time of ovulation is important. But again, we don't want to go so far that people feel like they're on a Monday, Wednesday, Friday schedule, and that they're looking at their calendar and going, oh no, it's Friday again. I don't think I can take this. So I think that there's a balance between stress reduction and optimizing chances of conception.
All right, very, very good. I'm so glad we received these questions and obviously did a great job of responding to those. Could you advance the slide, please? So thank you again, Dr. Stewart, for your excellent information and great advice on this very important topic. For those listening, again, visit resolve.org for information on a variety of topics related to family building and trying to conceive. We also have information on how you can get access to local support in your communities, and also how you can get involved with our organization, whether that be through advocacy and legislative initiatives, through our Walks of Hope, through our support group system, or other ways. We also have an online support community. And please reach out to us if you have any further questions on this topic or anything else related to Resolve. You can send an email to info@resolve.org, and we're very happy to respond to your questions and comments. And with that, we're going to close up this webinar. Thank you very much, Dr. Stewart, and thank you for those who are watching and listening, and we hope that this provided you with some excellent information. Thank you.
Thank you for the opportunity.